Hey, Team AidPlan, how long does it take for prostatitis to heal, and is it even possible? That is probably the most frequently asked question we receive every day. First of all, it depends on what kind of prostatitis you actually have. If you suffer from bacterial prostatitis, like 5% of all affected men, then the treatment is quite simple. As a rule, a visit to the urologist is sufficient. They will detect the infection with a simple test and usually prescribe you a course of antibiotics. After a few days and weeks, the infection should be gone and all symptoms as well. But in 95% of all cases, there is no bacterial infection. Tests by doctors and urologists are negative, yet the diagnosis of prostatitis is made based on symptoms. While this is fundamentally important, the term chronic prostatitis or chronic pelvic pain syndrome is much more accurate. Chronic pelvic pain syndrome is the generic term for non-bacterial prostatitis, or in other words, when the same symptoms as bacterial prostatitis occur but there is no infection. In these cases, the cause is often much more complex. It usually lies in chronically tense muscles in and around the pelvis in men, but in women. In addition, an irritated nervous system often triggers this tension and, together with the symptoms, develops into a kind of vicious cycle. Here's what happens. The pain or symptoms caused by permanently tense muscles and bonded tissue in the highly sensitive pelvic area irritate the nervous system. And the irritated nervous system in turn triggers tension and holds onto it, and so on. This is often why medication doesn't work and people affected often experience a long ordeal. But let's answer the second part of our most frequent question. Yes, chronic prostatitis can be cured. As we always say, what the body has caused, the body can, in most cases, heal. At least when it comes to tension. Yes, there are successful therapies that can break this vicious cycle, calm the nervous system and relax tense muscles and tissue. And when this happens, existing adhesions, the so-called trigger points, go away. Will it be easy? No. You see, we take a holistic approach, applying proven techniques from osteopathy, physical therapy, psychosomatics and classical medicine, so they work together. Will it be worth it? Absolutely. Guaranteed. We've seen countless cases in which, even after many years of pain, the symptoms of chronic prostatitis have massively decreased within a short time or have even disappeared. And that's exactly why we have developed an online course with AidPlan. With the help of experts from Germany, the United States and the UK, we've recorded a series of videos and created a precise therapy plan. Our 12-week program shows you, day by day, the exercises and techniques that help you take control of your body and relieve the chronic tension. During that time, we have you do exercises and training about 6 days a week. And don't worry, we first explain the exercises and then demonstrate them in our videos. All you have to do is register for our online course. Then you too can put an end to the vicious cycle and get back on the road to recovery. How long will it take, you ask? Well, it depends on so many factors. Don't pressure yourself. We know participants who have 50% fewer symptoms after 6 months, which was a miracle for them. We also know cases in which 90% of the symptoms disappeared just in 1 week. Stress is one of the triggers. That's why you shouldn't set yourself a deadline when treating chronic prostatitis. Enjoy any progress, because once you know what to do, you will have such a sense of accomplishment. Not to mention the relief. You will be the one to make this happen. Our job is just to teach you and motivate you to take action. Get active, take control of your pain instead of letting it control you. With this in mind, we hope this video will give you a little more knowledge. We see you soon in the online course.